Hello, everyone, and welcome to yet another session. I hope we are already live on Facebook right now. So, as you log in, please make sure you type in the chat box where you are joining from, which country, and what profession as well. I'd be interested in watching that as well. So, I'd be continuing on clinical communication skills. We have been doing that for a couple of sessions, and it's going to be a great session today. Here in India, I've got a little bit of inclement weather, but I hope things go well. So I look forward to your comments. Please type in so that I know you are there. Gunjan, good to see you. Yes, Neetu, great. Excellent. So I'll just wait for a few minutes till everyone joins. Casey, hello. Samreen, Jipin, Shikha, Vinita, hello Vinita. Khaled from Yemen. Dilna, hey Dilna, good to see you. Excellent. Right. I know that in some parts of India as well as in some countries, the tests have been cancelled, but don't worry about the test cancellations because what you prepare now will definitely help you. Yes, Nadia Suborno Neves from the Philippines, Parek, Amrita, Sadam, Rajini, Digo, Princey, Adnarim, Manasa, Surya, hi Surya, Simran, Kavita, Aimi again from the Philippines, Ahmad, Indrajit, Suborno, Tina, hello everyone, excellent. Sorry if I missed some of your names. I'll try to catch up. Suvita, Tina, excellent. Very good. Samreen from Pakistan, great. Ahmad from Kuwait, excellent. So I'll catch up with all of you in between. So let's get started. And I've got a thought for you as we start. So this is the world-renowned psychologist. If you have studied psychology, you know him, Carl Rogers. He says, I'm not trying to reflect feelings. I'm trying to determine whether my understanding of the client's inner world is correct, whether I'm seeing it as he or she is experiencing it at this moment. So that's very important for you to observe that as health professionals, as doctors, nurses, pharmacists, or whatever health professional you are. It's really important that you observe that. And let this thought stay with you throughout. Marwa from Sudan, excellent. Asaduzaman from Bangladesh. Rani, hi Rani, hi everyone. Right. Okay, so let's look at the implication of what we are learning today. We're going to look a little bit deeper into building relationship with the patient, especially some of the finer aspects. Ali Amin from Egypt. Hello, Ali, welcome. So what we discussed today is not just for your OET test, it's also for your work. So remember that these are things which are trending. You have to be really thinking about that. Right. So let's get going. So we're going to look at how you can be non-judgmental or what it means to be non-judgmental. Ria from London, Simla Jacob, hi. Hello, everyone. So I'm going to discuss few aspects of being non-judgmental, and then we'll go into some activities where you will learn what it means, right? So I hope you can hear me properly and also see the slides as it progresses. Great. So one of the important aspects is your ability to accept the patient's perspective and views. Now, every patient will have their views, their perspective, the way they see things. Do you accept that? Or is it difficult for you to accept that? That's a big question. That's a pertinent question. Can you think about it? Do you accept your patient's perspectives, views, and their opinions? Secondly, not rebutting them. So rebutting is like rejecting. A patient says, I've got, perhaps this is my problem. Yeah, Vinita says being more empathetic, excellent. Daphne from the Philippines, good to see many of you joining from the Philippines. Great. So not rebutting them, particularly at the beginning, it's very important. Sometimes as the conversation, as the consultation or the treatment progresses, you may have to tell them that what they thought was not the right thing, but at the same time, an initial rebuttal will lead to the patient not contributing to the discussion. So they may not tell you much if you initially rebut what they say. And finally, accept that they have got a right to have an opinion. Everyone, particularly your patient, has a right to have an opinion. So when you accept that, it's much easier. So this is one of the founding stones of having an excellent rapport with your patient, how you can build a good relationship. Hello, Naveen Babu, good to see you. Great. Anjali, hey, good to see all of you, every one of you. So I've got an example on the screen for you. Thomas Robin George sends stars. Thank you very much. And he is a master trainer himself. Excellent. So if you want your friends to learn and watch this lesson, you can share this stream. That would be really helpful for them as well. Excellent. Yeah. So here you have a health professional thinking, I know what's best for you. And the patient is thinking, or in his mind, he has this thought, I have my own view. And you see the desperation of the patient. So let's go behind the scenes and see what is the reason for that. So for the health professional, for most of you, those are important things: the sequence of events, the symptom analysis, the system review, the etiology, the prognosis. All those are going in your head when you see a patient. For the patient, it's about how it's going to impact his or her life, their expectations, concerns, ideas, and beliefs. So Naveed says he's an anesthesia nurse. Excellent. Yes, welcome, Dana. Simi, yes. Right. So, see, you have two sets of clashing ideas, concepts. So we are trying to see how you can bring that together, and that bridge will help you to succeed in your OET speaking, to be excellent in especially the clinical communication part, as well as at work later, particularly when you go and work in English-speaking countries where predominantly patient-centered care is at the center of the treatment plan. So this is exactly what I was telling. So for clinicians, for healthcare professionals, it's the biomedical perspective which is important. For patients, it's the psychosocial aspect which is important. So let's see how you can bridge these. Excuse me. So that's what we are going to do. and you are going to help me in doing that. So we have got a few problem solving sessions coming up. I will on the screen share a scenario which has some problems in it. It's not the ideal scenario. I want you to identify what the problem is and also think, probably type in the chat box, what alternative can be done. All right, so you have the patient who says, I still have the dizzy feeling. And the health professional, could be a nurse, she says, don't worry, it will be gone soon. The medicine is just starting to work. So you can see she has just started an IV infusion. So it's logically all right for her to think so that, after a while, the medicine will start working and then the patient's dizziness would be gone. But what do you think the problem is? If at all there is a problem, what is the problem? Please type in. I'm just waiting for your comments, and I know there is a slight delay between me and you, so it takes a few seconds. Yes. Ashwak says reassurance on drug side effect. All right. Oh, yeah. That's a valid point. And if at all the patient feels that the dizziness is perhaps because of a side effect, absolutely, yes. Rex says reassurance, yes. The patient should be transferred to bed. Austria, excellent answer. She has to be empathetic, similar, yes. She has to reassure what symptoms do you have, very good Jipin. Reassurance, transfer to bed. Neetu says it's not trying to assess more. Must show empathy. John Sia, excellent. Indrajit says procedure is not explained clearly. False reassurance. Maybe nothing to worry. We are here to help you, Vinita. Yes. Empathy is lacking. Exactly. Yeah. So let's see what the problem is. So here the problem is fundamentally from the communication standpoint. Yes, Naufia, you can show more empathy. Excellent. Anu says, I'm sorry to hear that, but nothing to worry. The medicine is just starting to work, right? That's what she says. But beyond that, side effects must be explained. Yeah, I agree to what most of you have to say. However, when a patient expresses feelings, just telling that this is what we have done, so just be quiet is not appropriate. So be more empathetic, show more concern, and also try to understand what the patient is going through. So on the screen, I've got something which is better. You can have other options also. Some of you had very good answers on the chat. Very good. So this is just an example. So you can say something like, oh, really, can you describe that for me, please? So the patient's feeling is accepted. So probably you may not be able to do much, but when you say that, they feel much better. And so they will start sharing more and more as things progress. And so that can be supplemented with something. Yeah. So can you describe that for me, please? And then the patient says it's like floating. So the nurse says, I see it should be gone soon. The medicine is just starting to work. And maybe I can add some of your suggestions, like I can shift you to the bed, or I'll observe you for a while, see if it's the side effect, and if so, I'll do something about it. So there are lots of options which you can See, Preeti says, I know this must be difficult for you. Excellent. Jibin says, Mrs. X, do you want me to stop the medication? Let's discuss your emotions. Excellent answer. Very good. Very good. Right. So, yes, Rani, you can check with the doctor exactly. But in the context of OET speaking, if the task doesn't ask you to go to the doctor, then you don't have to really say that. Because it's important that you focus on the task given to you in the OET's context. On the clinical side, certainly you'll have to do that. Absolutely. Prem says, speak slowly and smile. Absolutely, yes. So I've got a young man. Now, this is a story which came on CNN and was written by Elizabeth Cohen. Now, she has been the chief medical correspondent of CNN. And she has also written a book called The Empowered Patient, which you see on the screen again. Now, she narrates the story of this young man who had a headache, and so the doctor said it was due to dehydration, but the patient's mother had a gut feeling when she said, no, something's worse. So would you run him through more tests? And ultimately, it was found that he had a brain tumor. So sometimes the patient's gut feelings should be considered as well, although not always, certainly. Of course, as experts in your industry, as clinicians, as doctors, nurses, or whatever profession you are practicing, it's really important that you are good at it. But at the same time, there might be cues which patients will give you. So you shouldn't miss them at times. That might be really helpful. So Elizabeth Cohen herself wrote the book following an incident when her newborn child had to undergo spinal tap, and then she had it stopped because it's been going on, and still they were knee bent on having another spinal tap, and then she was really desperate, and so she narrates her own story as well. So it's an interesting read. So she says, although I've been handling medical news for CNN for 13 years at the time, she felt helpless. She knew a lot about the industry as CNN's chief medical correspondent, but still she herself felt helpless at that stage. Right. So let's move on to the next example. Now, these examples are designed so that you learn better than me telling you. I want you to think and apply these things so that it's like a brain gym for your clinical communication skill. Excellent. So the patient says, I'm feeling terribly low. He's not in a good mood. He feels slightly depressed, perhaps. What does the clinician say? I don't think so. You look upbeat. Yeah, he looks smiling. He is smiling. And anyone would think he's a happy person, but the doctor says, you look very happy. So I don't think you have a depression. Right. So can you tell me what the problem is? You're welcome, Rani. Please type in what the problem in this situation is, and then we'll think of how it can be rectified. I agree that, looking at his smile, no one would guess that he is depressed, but don't judge a book by its cover. So you see somebody very happy, they may not be really happy. Deep down, they may have some sort of sadness. Yeah, Mia says it's like arguing with the patient. Yeah, exactly. That's again the rebuttal which we discussed earlier. Elizabeth says, oh, I'm really sorry. Can you tell me more how you are feeling terribly low? Indrajit says we need to respect feelings and situation, absolutely. Simla says he has to agree with the patient and ask what happened, absolutely. Naufia says it's a judgmental reply, excellent. Gigi says contradictory statement, yeah. Austria says the practitioner should ask the patient about how he feels, yes. Ashwak says empathy and acceptance, very good. Patient could be hiding, yes, Reshma, the patient could be hiding his problem with his mind. Yeah. Rina says, what made you? Is there anything bothering you at all? Ibrahim says, assess the appearance rather than true symptoms. Okay. You can't really, judge from the appearance always. I'm sorry, but yeah. Can you tell me what happened, Sulochana? Yeah. He can support the patient, ask him why. Yep. Ask him if he has checked his blood pressure lately. Yeah. Yeah. Okay. So let's see what the fundamental problem is. So it's the initial rebuttal, which we had discussed earlier. The patient says something and somebody says, no, you don't have that. So it closes the door for an effective and, open communication. The channel is closed. And so that's something which you should avoid always at the workplace and also in the OET speaking test, right? And I've seen a lot of candidates do that during practice sessions. So the role play card says, the patient feels something. The patient is, let's say, the patient cannot care for, the carer cannot care for the patient. And then sometimes candidates ask, like, why don't you care? Why don't you spend some time at home? Or, all of that is absolute rebuttal. You have to explore the reason. Yeah. So let's see how you can proceed. So I flipped it. All right, can you tell me what makes you feel low? So you're confirming, accepting, agreeing that he is feeling low. And that's a good start, right? Starting to probe why he feels depressed. So that's really, really important. And then you can ask further questions. Yeah. And then he says, I haven't seen my family for ages, which is very common these days. Particularly, you have a travel ban and parts of many countries are under lockdown. So it's normal for people to feel a bit low. So the doctor says, I can imagine how hard it is. Maybe we could figure out how you can be in touch with them, help him with maybe technology, ask him if he has made video calls, things like that. So it doesn't matter what you do, but so it comes to collaboration. So the patient and the health provider will be on the same page, and that's an excellent start. And then that will help you to probably delve deeper into the reason for his depression, and also probably help him come out of it. And of course, you know that a lot of problems are psychosomatics. So sometimes quite often, you may not even need a lot of therapy if you have a proper communication channel open with them. Excellent. Right. So here's something interesting. Now, the health professional asks, is this your husband? And the patient says, no, he's my boyfriend. Can you identify what the problem is in this scenario? Please type in. Now, this is something that happens when you move to another country, when you have a different culture in the country you move to. Let me know what you think the problem in this scenario or in this conversation is. Making assumptions, yes. Phoebe, yes. So you're assuming that this is, yeah, again being judgmental, Indrajit. Rina says, I could have asked or confirmed with whom. Yep, exactly. Assuming. Sunita says he's showing care that husbands might. All right, but you're judging like, this is what a husband would do. Yes, Vinita, you can't ask personal questions directly. Felicita says the health professional would have asked, who the person is without coming to a conclusion. Nisha says all those who accompany the patient may not be their relative or spouse. Exactly. Jean says she should ask, what is your relationship? Exactly. Shanti says confirmation. Yep. So what you see is it's judgmental based on cultural and gender assumptions. Exactly. Or so that's something which happens sometimes, especially let's say when someone moves from one culture to another culture. So how can you overcome that? Good that you have someone to support. This is my boyfriend, Chris. So, yeah, exactly, Jayanti, Ashwat, yes, Gigi, Sunita, yes, excellent. Good to see wonderful responses from all of you. And so great to see that your communication skills are going up. Yep, right. Okay. Let's move on to the next scenario. Here you have got Alice. Yeah. Now this is also something which we may run into at times, and you should be very, very careful about this. I have personally experienced this a number of times while practicing with my candidates. So identify what the problem is when the health professional tells Alice, you're getting old, and that's why you have frequent falls. You shouldn't live alone. Now, Alice lives independently, and then she's being asked not to live alone. This is the reason for your falls. But Alice doesn't want to move out. She doesn't want to go to a retirement facility or a care home, or probably she wants to continue living in her home. A lot of people want to be independent, even in their advanced age. So let me know what the problem is. Hello, Seema, Princess Dubem Peters, good to see you. Right, data flow, yep. Hey, Avance. Abubakar says the doctor shouldn't have judged too early. Yep. Coming to conclusion straight away. Yeah. Indrajit, yes. Phoebe says insensitive. Absolutely. Right. Again, judgmental. And there is something called ageism. So ageism is when people, particularly of younger age, look at people who are a little bit advanced in age in a discriminatory fashion. So now it happens everywhere, at homes, generally in the society, but a little bit more in the healthcare sector, perhaps, because you have a lot of patients who could be advanced in their age. And then, so there have been a lot of research into this. Judgmental non-empathy, yes. Vinita, we can't tell the patient you're getting old. Very good, Vinita. Yes, this is judgmental. Yeah. Gigi Thomas says hurting patients' self-esteem. Absolutely. Tina says tell her that she should be careful. Yes, of course. Right. And you can provide a lot of solutions as well, even while helping her to continue living in her home. And yes, Daisy, reassure the patient. Absolutely. So it is very important. Now, remember, in most countries, particularly in the developed world, the authorities, the healthcare boards, the departments, the government is trying to help people be at home and provide the care they require rather than being hospitalized. So that's brilliant. So, I mean, there's a lot of advantage for it, probably for those governments and healthcare boards. It will help them to keep the cost of healthcare low. At the same time, it would also be very important for the patient as well. Probably less of hospital-acquired infections, and being comfortable in their own environment is always good. Vinita says, give positive support. Yep. Austria says maybe we should explore why she doesn't want to move out. Give some encouragement. Yeah, if that is absolutely essential, you may have to do that. Felicita says, show love and talk to patient in a loving way and make her feel loved and wanted. Nisha says, I absolutely salute your decision to live alone even in this age. Yep. Annabelle says, explore the patient's feelings. Nisha says, live alone. Yep. Be empathetic while asking these questions. Suja Abraham, very good. So let's see how you can resolve that. So here you have a response where the health professional says, Alice, you have had a few falls. Would you mind if we conducted an assessment for independent living? So somebody would come, maybe an occupational therapist would come and assess her home, make sure it's more friendlier, make sure it's prevents falls, like having handrails installed and things like that, toilet razors and all those things. Yeah. So that's a practical way out. So no ageism, respectful of her wish to be independent. And then she says, that sounds great. I know that I may need some assistance. So probably Mila says we could ask why she's not willing to move out and then give her options. Yep. Rani says should not be rude to patient. Absolutely, yes. So excellent. So I've got another example again. So I'm just skipping so that we can finish everything which is planned. So here you see that if you just lose weight, your symptoms will go away. So the patient says, I could hardly breathe yesterday. And the health professional says, if you just lose weight, your symptoms will go away. Caleb says, put yourself in the patient's shoes would help you not to ask questions that may hurt the patient. Absolutely. So this is something called medical fat shaming, telling obese patients that your obesity is the reason for all these problems. It could be, it couldn't be, but you should never ever tell your patient that this is the reason. So yes, it's absolutely judgmental. Sharita, Caleb, yeah. And so this is something which is a reality, something called medical fat shaming. So you're shaming the patient, thinking that they will stop probably, eating too much or eating junk food. And typically that may not be the reason behind the obesity as well. So there could be other reasons. So again, that's judgmental if you think that it's because of their eating habits, though it could be a contributing factor. So what could you say? Yeah, I'm sorry to hear about your breathing distress. Can you remember what might have brought it on? Did you do something out of the way? Were you exposed to pollutants or pollen or something like that? Did you eat something which you wouldn't typically eat? Lots of things to non-judgmentally assess the situation. So this is an example of a non-judgmental statement, does not attribute conditions to obesity. Right. Yep. Sanju is asking about writing. I'll cover that in another session, definitely. Yeah, could you please, Vinita says, could you please tell me more about your problem? Okay. Yeah, good. So Sanju, it depends. I suppose you're asking about using connective words. Well, firstly, I would say do not overuse them. But if you feel that it helps to link, excellent. Otherwise, you may not use it too much because it serves a purpose. Its purpose is to bring things together. But sorry, I can't go deeper into it. I would be digressing from what we're doing today. But I'd later on think of it once we do a session on writing. Excellent. Yes, Daphne. Manu, do you have any offers at IRS Group? Absolutely, yes. Please be in touch with us. At the end of the session, I'll share the contact links if you'd like to have special offers. And we have an app at IRS Group which you can download from the Google Play Store, and you have some free practice in it. So you can definitely go for that. Yes, Sunita, Felicitas, better say you can have some exercises and all about what brought about the breathing distress. Yes, listen and respond in a very polite manner. Yes, Rani, Akila, it shows lack of empathy. Absolutely. Austria, I understand how you feel. It might be difficult for you. Yep. Yes, Sanju, you're welcome. Right. So let's move on to another one. Yep. You're almost, this is the last activity we have before we go into a task from a role play card. So look at this. Are you a drinker? All right. So a lot of times, especially in, I don't know about all countries, but in India, patients are asked these questions. Are you a smoker? Are you a drinker? And it's a big no-no, I must say. So he says, I have some beer at night. Thank you, Rani, for your stars. Excellent. And then And then the doctor says, I see, you must stop it immediately. That's not sound clinical advice. Yes, Gigi Thomas asked if you mind if I ask you about your personal habits. Yes. Yes, Ashok, judgmental, very good. So oftentimes, even clinicians, clinical guidelines recommend that you should suggest going cold turkey. Now, you can tell that, although I haven't included it in the slide. So a more non-judgmental question would be, do you consume any alcoholic drinks, any alcoholic beverages? I have some beer at night. Thank you, Marina. And Karpagwali, thank you for your answer. Yes, if you don't mind telling about your personal habits on drinking. Divya says, yes, judgmental approach, absolutely. Reshma says, cannot stop all of a sudden, so assure him to get rid of it gradually with a period of time. Exactly. So that's what I said, Reshma, going, not to go cold turkey. So going cold turkey is like a sudden stopping. I don't want, you can tell your patient, like, I don't want you to go cold turkey, but probably we could, yeah, all right, how much? Would you consider reducing it? So he says, yeah, 3 glasses typically. So you can probably ask your patient, if they mind bringing it down. Absolutely fantastic. Same with smoking. So you shouldn't be asking like, and in many cultures, and I've seen it in my own culture here in India, like you ask like, do you smoke? How many? All right. So, you become infuriated when you hear all of that. You don't have to. You have to respect their personal views and habits as well. And then probably, yes, Jayanti, yes, Rani, very good. Tina, yes, I agree with you. So, yeah. So please do not bring your judgmental face even when something is unacceptable for you. It's as doctors, nurses, pharmacists, or all the health professionals, you're there to provide care and treatment, succor to patients, not to judge them, not to police them, not to bring in what in India we call moral policing. So be clear about that. So that's what this is all about, being non-judgmental and upholding their right to have their own views and not rebutting, so that they will contribute, they will be more open in the discussion. And one of the outcomes is that healthcare professionals who engage in patient communication of this sort find their work more satisfactory. So you'll enjoy not just the communication with the patient, but your work altogether. And in the OET speaking test, this will make you free. You'll be more relaxed talking to the interlocutor, because a lot of candidates do tell me that you get stressed up when you start speaking, and then you think, okay, this is a test, this is an examination, and so all of that will go away the moment you are more open, you are more non-judgmental, and you focus on building rapport, on relationship building. Right. So finally, I've got 2 bullets from a role play card. So the interlocutor's card says, the patient says that they're not convinced about taking the COVID-19 vaccine. A lot of people go through that now, right? And the candidate card says, find out the reasons for the patient to be concerned. So in your chat box, can you type, how would you find out the reasons for the patient to be concerned? What questions would you ask? What reassurance will you give them? Will you force them? Will you judge them? Simla says, hi sir, do we need to say come in and take your seat during community setting or in OPD setting? Really not. You don't have to say that. So it's not necessary. Come in and, because you're not enacting it entirely. So what you have to do, Simla, is start from the first bullet. So if the first bullet says find out about something, start by telling that, asking that. Rashmi says, do you mind telling me whether you consume alcohol? I would suggest reducing it. Yep. So I suppose that's for the previous one. Good response, Rashmi. Excellent. So give me responses for this bullet. Let me see how well your clinical communication skills will go in this part of the OET speaking. Vandana says, may I ask you what is bothering you to not take the vaccination? Very good. Angela says, could you please tell me what's holding you back from getting the COVID-19 vaccine? Yep. Indrajit says, I understand your concern. Would you like to tell me more about your concern? Yeah. I can see that you're a bit worried. Could you please tell me what's bothering you? You're welcome, Simla. Tony J says, I understand. Would you mind? Yes. Jesslyn. Yeah, the reasons to reject. Daisy, could you please tell me the reason you're not taking the vaccine? Yeah. Tina, may I know the reason behind your non-convincing? Shamia says, would you mind telling me about the concerns? Yeah. Could you please tell me the... Sunita, can you please tell me what's the reason? Yeah. Divya, Vinita, Ashwag, to confirm the situation, if you don't mind, could you tell me? Yep. Jamie, would you mind telling me what is bothering you? Yeah. Ninu, can you tell me the real reason? Yeah. Daphne, I could feel that you are worried about the COVID vaccine. Would you please share with me? Yeah. Jean, the reasons. Sneha, could you please tell me what is the reason? Yeah. Naomi, Ness, Peachy, Caleb says patient autonomy is very important. Yep. So what I don't want you to do is rebut. Adira, Vinita, yeah, good to see all the responses. So you can say something like, well, yeah, what you have done is excellent. So you can ask for the reasons. Can you tell what is bothering you about the vaccination? And then they would say, like, I've heard about all these issues, the blood clot issues and all of that. And then you can provide your support without rebutting. You don't have to say, like, no, all of that is false. You may have some statistics which you can use, but you may not always have that. That's all right. What you can do is get them onto the same page as you are before moving further. So probably you can assure that you would be supporting them throughout, you'll be observing them, and if at all something starts, you'll be able to help them with that. So it's more important that you do not judge their view, uphold their right to have a view, a decision, and that's really important. And so good to see all your responses. Thank you very much for all those. Yes, Sana, yes. So if you have any questions on what we have covered or about speaking in general, I'll take on a few questions. Please type in your questions. I'd be very happy to help you, and I want to see your clinical skills improve every day. Yes, Dora, Daphne. Thank you for your responses. Right. And if you require any assistance or training, online training from IRS Group, we'd be very happy to help you. Please download the IRS Learning app, or you can also visit the IRS Learning website, irslearning.com. You have a free orientation package. You can purchase other packages, and we would be happy to support you with your learning. Yes, Sunita, we do have. Please contact our student counselors in the phone numbers here. You can also contact them on WhatsApp or drop in an email. We'd be happy to respond to you. Indrajit says, do you have to ask the name? Well, you have a few options, Indrajit. You could ask the name of the interlocutor, but please do that during the preparation time. And it's ideal to use the interlocutor's name. There's no problem, but you could, if you want to confirm, you can confirm that. Alternately, if you want to give a name to the patient, that's equally acceptable. So it doesn't really matter. Very good question. Akansha says, if we exceed 5 minutes, will it be negative? No, at 5 minutes, the interlocutor will stop you. So you don't have to worry about that. And at 5 minutes, if you haven't covered all the bullets, that's fine. Perhaps you could still be in, one of the last bullet points. It's absolutely fine. You will not get any negative marks for that. What assessors assess is that you have spoken for 5 minutes, which is good. But if at the end of 5 minutes you're still in the first bullet, then it's a problem because you did not proceed, you did not carry forward the conversation. Your organization wasn't so good. Reshma says, how to mention the patient? Reshma or Miss Reshma? Well, having a formal salutation is absolutely fine. So you can call them Miss Reshma, that's fine. Sorry, what is the question about the how to start with an urgent care required patient in the emergency ward, right? You can introduce, but you don't have to have a long introduction. You don't have to say like, welcome to the emergency department. No, the tone of your voice. So you can say like, I'm one of the nurses in the emergency department and I see that you are in distress. Can you explain what happened to you or explain your problem so that I can really help you? So in an emergency situation, the language you use, your tone, especially, would match that. Let's compare that with, a home visit where it would be much more relaxed. So you would say like, hello, Mrs. Alice, I'm here for an assessment. I hope you're doing good, which you can ask in a home visit, but not in the emergency department. Yeah, but a quick introduction is fine, but not an elaborate one. Shahad says, ask if the patient is addicted on heroin, how can I, okay, in a non-judgmental manner, right? So you can say like, I see that you have been consuming heroin, which could be addictive. And so this is causing a few issues with your mental health, with your physical health. So I was wondering if we could discuss the issue, and I'd be happy to help you in getting over this problem if that's your wish. So that would be a good way. Allow patients. Caleb was asking about anger. Yeah. When a patient is angry, you can use something like, let's say, you can de-escalate the situation. Now, being non-judgmental will help you to de-escalate in itself. So judgmental comments will aggravate, make things worse. Yeah. Anu Thomas, is there a negative mark? Absolutely not. If you didn't complete all the tasks on time, you don't have to worry about it, Anu. You are not keeping the time. You don't have to be bothered about, 5 minutes getting over and you are still somewhere, you haven't reached the last bullet. That's fine. Right. The name of the patient in the ward, Gigi, it depends. Like, of course, you will go with the name of the patient. Yes, you have the charts with you, and so let's assume you know the name of the patient. Typically, if you are on, the role play says you are on ward rounds or something like that, someone is in the ward, it's an assumption that you have the details. You are not going for a surprise and like, hello, why are you here? What brings you here in the ward? No. If it's like a clinical visit, yeah. Tapita says, if the interlocutor is talking too much, will that be a problem? Well, you have to probably cut in, and then you have to talk. You're supposed to talk more, not the interlocutor. Absolutely. So it's about you having the control. The ball is in your court. We can't use must, should, need while speaking. It depends. Sushma, there's no hard and fast rule that you shouldn't use must or should. But you shouldn't use it in a very authoritative way, like you must do this, you should do this. Like that is not, a polite way of talking. But the patient should be, given something is fine. I think you must have an X-ray done. Perfect. I think you must have an X-ray done. So must is there. So let's not ban some words. I hear this a lot. Somebody told somebody that you can't use should, you can't use must. It depends on how you use it, rather than, there are no rules like these words are banned. Yeah. Probably if it's like, academic, or let's say some words which are too casual, informal expressions. Yeah. But otherwise, Reshma, what about pediatric department? Ask both parents and child's name. No, you would be talking to one of the parents. You would be addressing only one of the carers, so you don't have to worry about other people. Focus on the person you are talking to, Reshma. Right. So thank you very much, everyone, and it was such a lively, interactive session. Yes, Cindy, you can do that. Yes. So good to see all of you, and good luck with your preparation. Good luck with your work. Some of you are working extra hours, long shifts. So hats off to all of you. We are here to support you, and thank you, everyone. Stay safe, and I'll see you for the next session very soon with more on speaking and other aspects of OET preparation as well. Thank you very much, everyone. Take care.